And we are live. It's Dr. J here in the house. How you all doing? We had a great podcast this morning. Evan and I chatted about SIBO and its connection to IBS. I also had a great podcast on mold remediation with Jeff Bookout from BioBalance. We talked about using specific herbal formulas to actually clean out the house regarding mold and airborne mold in there. We talked about two different ways we can do it with the dry fog system using the BioBalance formula, as well as the Mister, which also works really good. And we kind of walked through all the do's and don'ts of mold remediation, the must, the things that have to be there, the things that if you don't do, you could spend a lot of money remediating your home and still not doing it right. We can do it in a very safe fashion and also make sure it's not, super expensive. We'll put the podcast links down below so you guys can access those. Take a look. Make sure you subscribe to get that cutting edge information. What's all on your radar today? New video out on histamine. We talk about histamine from a root cause perspective. Is histamine the root cause, meaning histamine the reason why you're sick, or is histamine an effect of other issues going on in the body with adrenal stress, with gut inflammation, with poor digestion, etc.? So we go over all that stuff in those videos. Make sure you access and subscribe. All right, what's happening? Any questions, let me know. Question is, Dr. I love your work. Keep it up. Question on my oat test showed high 4 crestal. However, the GI map showed no C. difficile. So with the organic acids, they're not going to ever show toxin A or toxin B. That's going to be your best marker. They are going to show the organics will show metabolites of these compounds. So I kind of always have a kind of rule in general. You don't need to have, let's say, agreement between the organic acid test and the GI map test. If one test says there's something, we're going to address it. The organic acid is looking at metabolites in the urine. The GI map is looking for the actual infection in the stool. So we have two different lenses that we're looking at the world through, your gut world through. So if we see it in the organic acid, guess what? We're going to treat it. We're not going to play this game and need everyone to be in agreement to make something happen. So I always typically recommend that we're going to go after that for sure. So a couple of things about histamine I wanted to highlight. So histamine's a big deal. People talk about histamine a lot. They're myopically focused on it. I did a good podcast with Yasmina Yakelenstan a few years ago on this topic. But histamine, so if you have gut inflammation, histamine can become a problem. And we may benefit by cutting higher histamine foods out, histamine releasing foods out, or DAO blocking foods out. These are the enzymes that break down histamine. That may definitely help. We also have to get to the root cause, because if we have a lot of dysbiotic bacteria, guess what? We may be stimulating a lot of histamine release through having dysbiotic bacteria, high amounts of bad bacteria, and also having low amounts of good bacteria. Lots of studies on this topic showing that the skew balance, the high amount of the bad, the low amount of the good, you may release more histamine in your body. Number 2, high levels of cortisol can definitely impact histamine release. Number 3, estrogen or estrogen dominance can also stimulate histamine release as well. So on the backside, we would want to focus on cutting histamine out through foods, histamine releasing foods, as well as DAO blocking foods. And I have a whole article and blog post on that topic. So feel free to see the links below or head over to justinhealth.com and search on the search bar for that keyword. So in general, histamine can be a big deal. So if you're having rashes, brain fog, cognitive issues, headaches, right, nausea, right, any urticaria or hives, we're definitely going to be focused on trying to cut histamines out and see how much that can move the needle in the meantime. Sometimes it moves the needle a lot, sometimes not so much, but we got to try. We don't know till we go. All right, any questions here, y'all? Feel free and let me know. We're just doing a quick little Q&A here today. Any questions, we'll dive in. So let me hit a couple of the highlights from today's podcast I thought was very important. So regarding mold remediation, a couple of things. I had JW Bavia on like a couple weeks ago where he talked about the testing and some of the remediation aspects. Jeff Bookout talked about using the BioBalance solution to help lower the mold count in the house. So we may test the mold count with what are called is agar plate testing. Those can be very helpful to test the mold count in the home. Number 2, we have to get to the root cause. Why is there mold in the home? Typically, there could be a leak in the roof or somewhere in the house. Number 2, it could be high levels of humidity, right? High levels of humidity. That's going to be a big one. And sometimes that air can come in through just having water up against your foundation. We need a sump pump installed, or if it's a new build, we can coat the inside and outside with a waterproof coating. But definitely getting a sump pump installed to keep the water away from the foundation is big. I would say after that, the big three are going to be a leak, high levels of humidity, and/or it coming in through the foundation and needing some kind of a piping to get the water away from the foundation, and/or a sub pump to keep it away from the foundation. These are our key things. Now, testing, we may use some of the mold plate testing to assess the levels of the mold. That's very helpful. That way, when we do treat, we can see post where we're sitting, so we can see if the therapy or the treatment for the house was helpful. Now, when we actually treat, the biobalance solution is the big one that we'd use. We'd use the dry fog kit. Small microns. The fog stays in the air a lot longer. So imagine these mold spores, like a golf ball or a tennis ball or a baseball, they go in the air and they fall. And the benefit of having the dry fog, it stays in the air a lot longer, a couple of hours. It's a little bit more dense, a little bit smaller in micron size. And that can be done. And you can dry fog each and every room. Get out of the house for 12 hours, let that solution work, let it permeate. Mold in the air will fall down. So if you kind of coat everything with that dry fog, it does provide a great barrier protection. So when the mold falls, it's going to be encapsulated and destroyed by the solution, by the natural biobalance solution. Number 2, we have a mister. Mister is great for maintenance. So it's really good for ongoing maintenance. You can do it once a month. Every couple of months is totally fine for that. That's better for after the fact. Or if we have minor amount of mold, or it's a smaller kind of unit, maybe you're in a small apartment or you're traveling, you can do some of the misters. The home setup is a really good kit, and that can be done. There's a travel one. Travel one's great for small, like, dorm room size, hotel room size. Spray the couch, kind of spray the bed, spray the area is fine. The at-home mister is probably your best one. You can get a little bit more coverage, a little easier. Really good for your home as well, just for generalized maintenance. So the fogging is really good for overall treatment. And then the mister for maintenance, or just the mister if the house isn't in that bad a shape. And again, we know because we're going to have those agar plates done so we know where the mold levels are at in the house and then we can follow up on the backside with a post and see where we're at. I've done this on my own home. I had mold in it at one point, was able to test it. It tested high in the exact room that it was visibly in, treated, knocked it down to almost nothing. So I personally follow all of the advice and all the things I recommend, and I found them to be the most successful. And having worked with patients over the last 10 years who have done very expensive mold remediation, I can tell you this is a much more cost-effective way. And more importantly, you're not going to get all of the dangerous metabolites from ozone or concrobium or other types of compounds that are going to be used to kill the mold. So topically, we like hydrogen peroxide between 12 and 22%. Then we use the dry fogging solution after the topical mold's been hit. We target the mold and we do 2 feet around the mold. So, hey, here's a dry spot. We're going to do 2 feet on either side of it. Cut it out. We'll topically hit any area. Then once we topically hit visible mold, then we dry fog everything. And key, this all has to be done, or at least the spot treating of the mold and at least the cutting out of drywall or material has to be done in a negative air containment environment to not spread the mold outwhere. Just throughout the house. Those mold spores will move, so we have to make sure that if we're moving it or cutting it or spraying it topically with the hydrogen peroxide, that we are doing it in negative air containment. Now, once that key stuff has been done, you could do the dry fogging in a non-negative air containment. That's totally fine, but the cutting and the initial spraying of topical mold would need to be done in that negative air containment, and then secondary stuff, systemic, using the dry fog, can be done outside of that. I hope that's helpful. A lot of different things that need to be done, but I can tell you, if you have a mold issue in your home, it's very expensive and it's very overwhelming. And in the podcast, we went over a lot of the big things to do and to address, and the big deal breakers that can make a huge difference with getting air circulation. We talked about HRV and ERV to help with good air circulation. These are all good options for you as well. We'll put the podcast link below so you guys can see that, and hope you subscribe to get more access to that great intel. Couple questions here before I sign off. Phosphatidylserine, what's your take on it for lowering cortisol? Phosphorylated serine is great. I like phosphorylated versus phosphatidyl. Phosphorylated serine is one metabolic step down the cascade, so it's easier to. It has, let's see, a better effect because your body has to convert phosphatidyl to phosphorylated serine. So I like phosphorylated better. It does sensitize the hypothalamus to cortisol. So if your cortisol's high and then your hypothalamus kind of gets shaken a little bit, it's like, hey, you got high cortisol. It kind of wakes it up a little bit. It sensitizes it to the cortisol and then brings the cortisol stimulation down. So kind of get you out of that fight or flight response and helps bring it all down. Bleach is cheaper and more cost effective. You will get a lot of dangerous metabolites that come off of the bleach. That is the problem with it. Yep, that is the problem with it. I mean, if it's a quick, simple area, you're much better off doing the BioBalance spray, or you can even get some Thieves or On Guard and a couple of drops, do it in water and spray it. That's a good way to do it. The bleach does have a lot of nasty fumes that come off, so you got to be very careful with it. In the podcast, we talk about some of the dangerous metabolites that occur when you hit the mold with some of these more noxious compounds like bleach or ozone or corncrobium. These metabolites aren't good, and they can create more problems than the mold actually causes. That's the big issue. We also talked about in that podcast air filtration, 11 on the 11 micron size for the filtration is what you want. I think it was the 11 microverts. I forget the exact terminology. It was in the podcast. And then, of course, we have filtration in each of the room that's going to be a much smaller micron size, 16, and that works phenomenal. I'm a big fan of the Austin Air. Air Doctor's good. Air IQ's also good. These are really good filters to help knock everything down and kind of take some of those volatile organic compounds or the mold volatile organic compounds. I had a major leak in my house. They said standing water under floor. They're coming to remove it. Worried about mold. We'll tell them about the negative air containment because they downplayed mold issues. Yeah, got to have this all removed. Now, again, mold starts to form in about 48 hours, right? After 48 hours, if that water can't move, it'll start getting moldy in there. So number one is try to keep the environment, drier if you can. If it may already be dry, it may just be an acute water leak. Number two is if it's after 48 hours, you definitely want to have them remove it in a negative air containment just to be on the safe side. That's really, really important. And yeah, I would try to get some kind of a sub pump, if you will, to soak it all out of there and just get it out as fast as possible. 48 hours, those mold spores start forming, and then afterwards, I'd spray it down with either the dry fog. If you get it out in time, I would do the dry fog to be safe. If you don't get it out in time, you could always hit it with the hydrogen peroxide 20%. That's the best one. 12 to 22% is the best to use. It creates the least amount of toxic metabolites, according to Jeff Bookout, if you listen to the podcast today. So yeah, hydrogen peroxide is better, and then the essential oils that are in the BioBalance are super helpful and helps encapsulate the mold, and is a very cost-effective way to do it. Excellent. Yeah, 4 weeks, yeah, you got to get that thing out. I would work on getting some kind of a pump to get it out of there, and you need to figure out how that water got there to begin with. So if that leak is fixed, great, then you're set, but you got to get it out of there, and you got to make sure that you have everything fogged up afterwards. Hope that helps. Yeah, the dying mold creates toxins. Yep, exactly. We got to be careful with that, and we got to make sure that we don't create more toxins with the compounds that we use to kill it. That's the tough thing, and a lot of conventional people in the mold remediation industry aren't aware of the secondary toxins. That's the missing link a lot of people don't understand. So we want to use ways to do it the right way, and most people don't. And in the podcast, Jeff Bookout offers virtual home inspection as well to look at everything. So if you need a set of eyes and a way to assess what's going on, this can be a great way to do it. Yep, excellent. Hope that helps y'all. Are any other questions? Feel free and let me know. If not, I got to head over to the gym and get my pump on here. Let me know what's happening. Oh, your wife left the bathtub on upstairs for an entire hour? Oof, that is nasty. That is bad. Yeah, my wife almost did that. It was in the laundry room, and there was tile, and it started leaking a little bit, but it was on tile, so it was okay. But I'm just like, all right, if you ever turn something on and you walk away, you need to put an alarm on your phone to remind you within like 3 minutes. Like, that's like my big reminder. You turn water on, you walk away from it, you set an alarm. That's like our standing rule. Are any of the questions? Feel free, guys, let me know. All right, I'm going to sign out here. Take a look at the podcast today. It was very helpful on mold. Evan and I chatted about SIBO and the IBS connection. IBS is strongly associated with SIBO up to 40% of the time. 40% of patients that have IBS symptoms, bloating, gas, constipation, nausea, stomach pain, without the typical IBD issues, right? Inflammation, ulceration, without those issues, they're typically diagnosed with IBS. We talk about SIBO and its connection with IBS. All right, y'all. Hope all is well. Oh, what are the active ingredients in the fogger? So in the fogging solution, the BioBalance solution, the active ingredients are lime, lemon, tangerine, grapefruit, and orange peel. It's about 5 or 6 different essential oils. They use a tiny bit of propylene glycol to encapsulate it. That allows it to go in the air and stay in the air longer for 2 hours, and that allows it to kind of encapsulate and kill that mold without quite creating all those dangerous metabolites, which is great. Really nice, not a whole bunch of toxic crap in there. All right, y'all, you guys have a phenomenal night. Enjoy yourselves, and I'll be back later on this week. Keep the questions coming, and if you enjoy it, put your comments down below. Thumbs up, subscribe, hit the bell. Appreciate it, y'all. You guys take care. Bye now.